Today, we're taking a peek behind the curtain at what is, seriously, one of the most skilled forms of photography out there, the neck X-ray. It's this incredible craft of precision, and it's all built around solving one central challenge. And there it is. That's the big question. How in the world do you get a clear picture of some of the most critical bones in your body when they're literally hidden by your own jaw and skull? Figuring that out is the key to everything we're about to dive into. So here's our game plan. First, we'll look at just how crowded the neck really is. Then we'll see how you actually photograph an airway. After that, we solve the puzzle of those tricky top vertebrae, get the big picture of the whole C-spine, and finally, I'll let you in on the secrets to what makes a perfect X-ray. So what makes this so tough? Well, your cervical spine isn't just floating in space. It's packed in there with your trachea, your esophagus. It's a really crowded anatomical neighborhood. Getting a clean, unobstructed shot of the bones takes some serious strategy. Now, you'd think we'd start with the bones, right? But interestingly, the first part of this journey isn't about bones at all. Before anything else, radiologists often need to check out the soft tissues, the passageways for blockages or swelling, and that requires its own special set of pictures. What's so cool here is how these two simple views tell completely different stories. You've got the AP view, which is from the front. That's perfect for seeing if the trachea has been pushed off to one side. But then you have the lateral view from the side, which shows you if something's squishing the airway from the front or back. Each angle is like a different detective, looking for a specific clue. And to get an even better look, the pros use some pretty clever tricks. A radiographer might ask you to make a long E sound, which helps highlight the vocal cords. Or they might have you do this, the Valsalva maneuver. You're basically bearing down while holding your breath. These little actions actually change the pressure and density inside your throat, which makes certain things just pop on the X-ray. It's kind of like using a special filter in photography to see details you'd otherwise miss. All right, let's circle back to that big problem from the beginning. How to see those top two vertebrae, C1 and C2, when they're hiding behind the jaw. These guys are absolutely critical for turning your head, and seeing them clearly requires one of the most elegant solutions in all of medicine. And here it is, the open mouth shot. It's so brilliantly simple. The problem? Your jaw's in the way. The pose? Open your mouth as wide as you can. But the real magic is in the alignment. By tilting your head just so, lining up your top teeth with the mastoid tip, that's the bony bump right behind your ear, the jaw moves completely out of the path of the X-ray beam, giving it a perfect, clean shot of C1 and C2. But getting that alignment right is a game of millimeters. I mean it. Tilt your head back just a little too far, and the base of your skull blocks the view. Tuck your chin just a little too much, and now your teeth are in the way. The margin for error is razor thin, and getting it wrong means the whole picture is totally useless. So, what happens when a patient can't open their mouth, like in a trauma situation? Well, there's always a plan B. It's called the Fuchs method. Instead of trying to shoot through the mouth, this technique has the patient tilt their chin way, way up. This projects the dens, that key part of the C2 vertebra, right up into the foramen magnum, that big opening at the base of your skull. It basically creates an alternate window to see what's going on. Okay, so we've zoomed in and isolated the tricky parts, the soft tissues and those hidden top vertebrae. Now let's zoom out and look at the workhorse views that capture the entire cervical spine from C1 all the way down to C7. These are the two big ones. First, you've got the AP axial, which is that front view. But look at the angle. The X-ray tube is actually tilted up 15 to 20 degrees. That's not random. That specific angle is designed to open up the spaces between the vertebrae so you can see the discs clearly. Then there's the lateral view, a straight side shot, which is absolutely essential for checking the overall alignment and curve of the spine. So what's this number all about? 72 inches. For that crucial lateral view, that's the standard distance from the X-ray source to the image receptor. Why so far away? Well, think of it like a portrait lens on a camera. A longer distance reduces magnification and distortion, which gives you a much sharper, more true-to-life image of the spine. It's all about getting rid of any optical illusions to see the truth. Here's another one of those hidden challenges, especially for the lateral view. Your shoulders are thick and bony, and they can easily block the view of C7, the lowest vertebra in the neck. So the solution is purely physical. Patients have to pull their shoulders down as far as they can, sometimes even holding weights, and then hold their breath after breathing all the way out. That helps the muscles relax and drop the shoulders just that extra little bit. So now we've got our images. But what really separates a decent picture from a perfect diagnostic quality X-ray? Well, it all comes down to a clear set of rules, a kind of secret code that radiologists use to check for alignment and spot any injuries. This right here is one of the most important secrets. When looking at a lateral C-spine, a radiologist mentally traces these 4 imaginary lines along the vertebrae. In a healthy spine, these lines should be perfectly smooth, parallel, and have a gentle, sweeping curve. It's like finding a hidden language written in the bones.
And any break in those smooth lines, what's called a step-off, is a major, major red flag. The technical term is spondylolisthesis, and it's a sign that a vertebra might have slipped out of place. This is exactly what doctors are hunting for when they're looking at these images after an injury.
So when you put it all together, you realize that taking an X-ray like this is an incredible mix of physics, anatomy, and pure artistry. Every single angle, every instruction, every tiny adjustment is designed to do just one thing: provide a crystal clear answer to a really important question about someone's health. So the next time you happen to see a medical image, try not to see it as just a black and white picture. Look a little closer. Think about the angle, the positioning, and the amazing details they managed to make visible. Because every one of these images tells a story of incredible problem solving and precision, just waiting for you to read it.